Good morning, everyone. My name is Katie Florence. I'm your chair for this session and also Assistant Director of Comms Engagement and Insight at Social Work England. A very warm welcome to Social Work Week and this really topical discussion that we have this morning on a challenge for social work looking at workforce reform and retention. I'm delighted to welcome Sarah, Ade and Tricia to the panel to reflect on the key issues of the last year and what the future looks like for the social work profession as we move forward. As Catherine mentioned, there'll be opportunity to pose questions using the Q&A function, and we will hold some time back for those at the end of the session. But as you can imagine, with this topic, there's a lot to get through. So without further ado, I'll do a quick round of introductions to your panel, starting with you, Sarah, if that's okay.
Thanks, Katie. My name is Sarah Blackmore. I'm Exec Director of Professional Practice and External Engagement at Social Work England. Good morning, everyone.
And Ade?
Ade Sosoi, Chief Executive at the London Borough of Bromley. Good to be with you this morning.
And Tricia?
Hi, good morning, everyone. I'm Tricia Pereira. I'm Director of Operations at Skills for Care.
Thanks, everyone, and welcome. So, Sarah, over to you now.
Thanks, Katie, and good morning again, colleagues. It's great to be here with such esteemed colleagues, including all of those of you who've given up your time to join us this morning to mark the beginning of Social Work Week 2023, the third Social Week of its kind so far, and by far the biggest yet. I've just introduced myself. I'm part of the leadership team at Social Work England, and this morning we are going to talk about arguably the biggest issue currently for the social work profession, workforce and workforce issues. My colleagues Ade, Tricia and I will be coming at this from slightly different perspectives, but with certainly equal passion for and commitment to positive change. And so I wanted at this stage, before we begin, to pause and to say a huge thank you to all social workers for all that you do in such difficult circumstances, particularly at the moment, and the profound difference that you make every day to so many people's lives across the country. We see you, we hear the issues, and together we will do something about it. This morning, I'm going to talk about why we as the regulator are interested in this and what we have found so far, what we're doing about it, and why there is reason to be hopeful. I will then hand over to Ade and Tricia, who have been sterling colleagues in this work to address this and to share their expert perspectives. I don't think many people would disagree that there is currently a workforce crisis across the social work profession. The Department for Education recently published some pretty stark figures on children's statutory social work. Previously, we'd heard very similar about adults. And that's before you consider the many other contexts in which social workers practice, the NHS, the voluntary sector, and independently. This has not happened overnight and has been building for many years now. And we now have what seems a perfect storm, due among other reasons to the cost of living crisis, societal issues affecting our most vulnerable families and communities, high caseloads, inflexible working practices, issues of disproportionality, perceived low status and credibility of the profession linked very much to negative perceptions and media representation of social work. These are all complex issues and will not be resolved easily. So far, any action that has been taken has re-emphasised what is an already fragmented profession and been tactical rather than addressing the whole system change that's needed. As the regulator for the whole of the social work profession, we are concerned at what's happening in the workforce from entry into the profession at the earliest stage, right through to retaining our most experienced colleagues and the development and retention also of our leaders. One of the reasons that we as the regulator became involved is concern at that fragmentation in the sector more generally, but also in response to workforce issues, and the suggestion of helpful yet tactical responses to address what is a whole system issue. In the many individual and group conversations I've had about this, and there have been very many, I have seen the very best of our profession, people recognising the issue and with the commitment, drive and passion to do something about it. Unfortunately, though, I've also seen the opposite. We've heard a few voices almost seeming to pit one element of the profession against another, dismissing others' experiences as less important or acute than theirs, and pointing fingers at who's to blame. None of this helps us move forward. And while there may be elements of recruitment and retention in social work that are being felt more acutely at times in certain parts of the sector, I emphasise again, and will continue to do so, that workforce in social work is a whole system issue and needs a collective response if there is to be any meaningful change over the longer term. There has also at times been almost a sense of naivety alongside some of the suggested tactical responses. So, for example, if we just ban all agency work, that'll solve the problem. Well, of course it won't. If we just bring in lots of international social workers, that'll solve the problem. Well, of course it won't. Or if we just give social work tasks to social care workers, that'll solve the problem. Of course it won't. And I'll speak more about this in a minute. If only it was that simple. This complex situation that has arisen over decades now will take all of us involved in the system, be they regulator, local authority employer, agency, education provider, government department, to take a good hard look at ourselves and ask some difficult questions about how we may have contributed to where we are now and what we could do differently to bring about change, however difficult that change may be. Nothing should be off the table. It's time to have those difficult conversations, constructively challenge one another, and be positively disruptive. All that is necessary if real change is to be achieved, and it will take all of us. The suggestion that getting rid of agency social work is a solution is a red herring. There will never be a time when social work will not need some element of agency workers. Issues arise where the practices of some agencies, and it is only some, are unacceptable. For example, the ones who will only sell a very expensive team of workers, or who encourage social workers to breach their professional standards by telling them they won't have to do face-to-face visits. Those practices need to stop, and those agencies will be dealt with. But in having been part of creating the problem, agencies also need to be part of creating the solution. And so in the work that we are doing, agency input will be important and welcome. Similarly, when it comes to international social workers, as part of a carefully thought through wider workforce strategy, bringing in workers from overseas may well have merit and be part of a wider solution. What we have seen so far, though, is a knee-jerk approach where overseas social workers are being recruited without local support, cultural adaptations, pastoral care, or sometimes even a recognition that there may be registration or qualification issues. There are also important ethical considerations of moving social workers from countries where there is already great need for them to deal with a problem that we have not addressed. And then to the increasing delegation to social care. There is a real risk here in the gradual erosion of the integrity of the social work profession. If we continue to say that work previously only qualified registered social workers could carry out can now be done by unqualified workers, what are the longer term implications for our profession? Who manages the risks associated with this? And what does this mean for social care provision, which is badly needed where it is and not as a stopgap for another workforce? It's time for a broader, more considered systemic approach. It's time for a national workforce strategy for social work in the same way that the NHS has the 5-year forward view. So as the regulator, we're beginning to address this in a number of different ways from our view across the whole of the profession. We're analysing the very rich data and intelligence coming to us from across the sector, some of which you will hopefully have seen in our State of the Nation report, which we published last week. We're commissioning research on workforce to ensure a clear evidence-based foundation to work from. We're working with DFE colleagues, Department of Education colleagues, on their approach to issues in children's social work, of which we'll then be able to read across into other areas of work and ensure join-up and complementary activity where appropriate. We're having many constructive conversations with colleagues in the Department for Health and Social Care and the Department for Education, with our regulatory colleagues in other sectors, with key networks and stakeholders, and there are certainly regulatory levers that we can pull to help affect change. As colleagues know, there are lots of developments happening at the national level that are impacting on social work and social care and the many different contexts that social workers operate in. We want things to get better for social workers, but we can't do that alone. So we coordinated a national roundtable discussion to bring all of those elements together and to bring system leaders together across the profession who can commit to driving forward and leading meaningful change. Our part of the roundtable meeting was to simply offer that coordination role to colleagues who were present and to say, come and work with us on this, recognising that it will take all of us to make change happen, and with an expectation that in going forward, members will commit to action. Without that central coordination, there is real danger that the very many conversations that we know are taking place every day across the country about this will result in us tripping over one another and may prevent any meaningful change from happening. And at the discussion, it felt like there was a real sense of collective energy and momentum for change, whilst recognising how difficult that might be and how a radically different approach might be necessary. So we're setting up 3 work streams that will involve practitioners as well as system leaders, and we'll be calling out for people to come and join us to help with these conversations. And they'll focus on different aspects of the issues, with the original roundtable group coming together as an oversight forum every 6 weeks to monitor action and provide leadership and resource. We're very publicly speaking about this and highlighting what we're doing to ensure visibility and so that the sector knows that we get it and we're on it. We're clear too that equality, diversity and inclusion is a key thread that will run through all of the conversation and discussions and be part of the plan for action that we develop. It's very easy to feel utterly depressed and without hope when you talk about these seismic and complex issues. But there is hope and opportunity, and perhaps for the first time, a universal recognition of the fact that change is needed and must come, and a willingness to step up of those who are in a position to bring that about. It is something that I'm really excited about and see real opportunity to move forward, and I look forward to continuing the conversation with all of you. And I'm delighted now to hand over to my colleague Ade, who's going to tell you his perspective. Thank you, everyone.
Thank you, Sarah. And can I also say a big thank you to colleagues on the call this morning as we celebrate the fantastic work done by social workers across the country. As Sarah rightly said, Ade Adesoi, Chief Executive in the London Borough of Bromley, social worker by background with over 30 years of experience in practice. Just really, colleagues, to take you through 3 key things that I will cover in the next 8 or 9 minutes. One's really to set the context in terms of the evidence base for what we're trying to do within the sector, really to support social workers. Secondly, to really reflect on some of the key barriers that social workers shared with us in terms of recruitment and retention. And thirdly, to really think about what we need to do as a sector. So the context in terms of what I'm about to say, sometime last year, we had a program called The Big Listen, whereby was a research done across in London and South East London boroughs, whereby 1,200 social workers responded to the Big Listen survey and really provided us with their own sense of view in terms of what we can do differently to tackle some of the key issues around recruitment and retention. We're over 150 colleagues that came into different events. We've been able to get the evidence base really to set out what we need to do differently within the sector, really to attract well-able social workers and managers. The report in terms of the actual Big Listen will come out next month, which is again through an organization I chair the board called LEA, and the directors of children's social care, children's services in London. So at some stage in April, you'll get a center of the report. Just reflecting on the fundamental question, what are we trying to achieve? Two key things in terms of colleagues on the call working with children. How do we as professionals ensure that we support through stability the children that we work with, was the first key question that we raised. And secondly, what are the key barriers really stopping us as professionals from delivering good social work services in different local authorities? What came out, which shouldn't really be a real surprise from the survey, we came up with about 6-7 key areas that social work frontline staff in local government actually shared with us as some of the key barriers really stopping them from actually coming into the profession or even staying in the profession for a long period of time. And if I may, the first thing they reflected on was 48% of the colleagues that completed the survey reflected on the caseload within the different local authorities. One of the key things that we as a sector really need to address, in the same way that we're addressing that in my own local authority, is actually the workload of social workers in terms of frontline staff. And that's one of the key barriers that we really need to think about. The second thing that colleagues told us about was the resources. What do you actually need to do good and effective social work in local authorities? Again, colleagues who really participated in the survey fed back about not having enough resources really to carry on and support families and adults that they were working with. And again, I'll come back to those points in a second. The third, post-pandemic, the well-being and the excessive hours that social workers worked was another reason that they gave us for not staying in the sector, as well as not having the flexibility that other professionals have in different sectors in terms of the hours they work and how best to actually get them self-supported in the workplace. 2 or 3 other things that practitioners told us: lack of career advancement, lack of opportunities in their own local authorities, and at the same time, some of the key issues in terms of not being able to work in the same way they've been trained to as frontline social workers in education, and coming into employment, not being able to really have that same joy. So we reflected as a group of leaders to think about what can we actually do differently. If you were to go through a number of local authorities who are failing, one of the key barriers was actually not really having the same stability of staff within those local authorities. And through LEA and through the work that we're doing, not just in London, but in the southeast of England, is really trying to look at some of the ways to address those fundamental issues that the survey gave us in terms of things we need to do differently. Part of these is really trying 2 things: to increase the profile of social workers in local government, and at the same time, how do we then ensure that social workers get the support at the back of poor inspections and also poor narrative in the press in terms of be it adult social care or children's social care? That led us, colleagues, to a different piece of work in terms of through LEA and through the Association of London Chief Executives and also Children's Services Directors, to really think about the fundamental issues that might change in our profession to really retain staff. So we do have a program in London, Southeast London, whereby we working on a different work stream to really look at the appropriate caseload for our frontline staff in children's services and also adults. This is a piece of work that we've been trying to define. What can we actually do to ensure that people are not coming into the profession and haven't spent a year feel they need to disengage from the profession as a result of the workload? That's a piece of work that we're doing, which again will be publishing in a few months' time in terms of what we're recommending to other local authorities in terms of what the caseload should be. The second, which we are seeing as part of the research in terms of the evidence, is actually the capacity within local government, whereby a number of colleagues, not just in London, but South East London, are putting up well-being programs to support social workers in employment. What does this really look like in terms of the ability and the time to reflect on caseload, to reflect on practice, and at the same time, the ability as well to really have that time to really have senior leaders in organizations saying to frontline staff, thank you for the work you do. What can we actually do as well in terms of increasing and improving the image of social work? So as we celebrate this week, it's a good opportunity for us really to go back and actually celebrate the fantastic work we do as a sector. I came across colleagues last year. As I said, I've been in social work for a long time, and I actually remember doing an adoption case way in the early 90s and during social work week last year. A child who I probably called Nick tracked me down in his 20s, really to actually say, look at I went through the case file. Thank you for what you did 20-something years ago, because I took Nick away from his family, placed him with a lovely family who adopted him. Nick progressed to university and is actually doing really well. And that thank you came 20-something 2 years afterwards. So I think in terms of what we do, colleagues, really to recognize that, yes, society do value what we do. The thanks might not come straight away. We might see ourselves going in every single day and every single time, working as hard as we can be, but really not getting society to value what we do. I can actually say to you colleagues this morning on behalf of Nick, thank you in the same way that Nick tracked me down last year to thank me. And I'm sure that you will find your needs to really thank you for the work you're doing. And let's really continue to make a great profession, social work, the one that really enables and helps in terms of changing the outcomes for children, changing the outcomes for adults that we work with. And let's really continue to do whatever we need to do to tackle some of the key challenges that we face as a society, as Sarah rightly acknowledged. The last one I'm going to leave you with, for colleagues who are newly qualified, there are 2 or 3 things you probably would expect me to say. In London, we're pulling together all the vacancies across London through a standalone recruitment portal, which will be coming out again in April, that allows newly qualified staff to go to the portal to really get a sense of the 33 local authorities in London and really to understand the vacancies that they've actually got. The second thing we're doing is that we're actually publishing again in London authorities and South East authorities what we actually see as social work standards, really to encourage people coming into the profession to focus on the key issues around practice when you do join. And then the third, again, for medium, long experience social work staff, is actually around the training and development. So again, through London and South East London, we're pulling together a program that allows people to come in and to be trained in a way that will benefit you as you go through your career. So please do look out for those 3 key things that we are pushing through in London and South East London. I'm going to stop there because I think I might have done my 7 minutes, and I look forward to taking key questions afterwards. But as I said at the beginning, big thank you to all of you as we celebrate Social Work Week. Thank you, and I'm going to hand over to Tricia, who will also give you a perspective in terms of what she's doing in her own organisation. Thank you very much.
Thank you, Ade. And thank you for inviting me to join on this panel, Sarah and everyone at Social Work England. So we've already heard a little bit about the challenges, and we've heard that we're working through the perfect storm, the triple danger to the profession of social work and workers in social care. And some of these challenges started way before the pandemic. So my name is Tricia Pereira. I'm Director of Operations at Skills for Care. I'm a social worker by background, and I've been at Skills for Care just nearly 2 years now. Before that, I was working in a local authority as head of adult social care, social services, and head of adult safeguarding. I've spent most of my career, well, all of my career, working in local authority settings. But as we started, we're seeing the perfect storm, the triple dangers, the impact of austerity, the ongoing impact of the pandemic, and the cost of living crisis, all wrapped up to have a real effect on the way that we work as social workers. Now, the pandemic had and continues to have a devastating effect, but what COVID did was expose and add a spotlight to the long-standing workforce challenges, because these are not challenges that happened overnight. These are challenges that have been around for some time. So they're challenges that are going to take us a little while to unpick and to improve and increase, but we are committed. All of us are committed, as Sarah said at the start, around the work around the round table with Social Work England. We're all committed and all pulling together to look at some solutions. So we know about the escalating numbers of requests for support. And I just want to start by saying a little bit about the social care, the wider social care workforce, which in its entirety, social care workforce is over 1.5 million workers. Now, we know we're an ageing population, and the workforce, the social care workforce, is an ageing workforce. But that's not too dissimilar for other workforces, other sectors across the wider piece. 80% of the social care workforce are women, and 28% of adult social care workers, female, are aged 55 and over. So this age group accounted for around 430,000 filled posts in adult social care. So therefore, from a workforce planning perspective, it's important that we take this into consideration, because these workers may be retiring within the next 10 years. The average age of the workforce is marginally increased, so from around 42, 43 years in previous years to about 44 years. But as I've said, it's not exclusively for adult social care. Now, we always hear about the vacancies within social care, and we know there are 65,000 vacant roles currently. But actually, as Ade said, having a narrative that supports people, the attraction of people understanding social care and being attracting to roles to work in social care, that's 65,000 opportunities for people to start their careers and to grow and develop and aspire as future leaders. So we're focusing on raising the profile of all social care careers. And it's important that we know all of this, because we know that there's an increase in requests for support. So we have had, across the sector, across local authorities and social care, we've had almost 20 million requests for support from new clients received by local authorities. And that's an increase of around just under 3.5%. So that's nearly 5,500 requests for support from new clients each day, up from the average of around 5,200 last year. And people aged 65 and over accounted for nearly 70% of those requests from new people. And many requests were to provide short-term rehabilitative support, allowing the person to avoid any long-term support needs. So we are, at Skills for Care, we're doing work around the role of the current and future workforce and how social care workers can support people in their own homes, in the community, not only providing short-term, but that re-abling model of working to around prevention to increase independence and reduce longer term needs. Now, these additional requests for people who have care and support also, that goes hand in hand with an increase in requests for support from carers, family, unpaid carers, who have also increased. And I hear more and more about family carers, unpaid carers being talked about in the same way and being included in conversations as paid professional care workforce. And we really do need more investment in supporting family unpaid carers, because they're not part of the workforce. They're not part of the workforce in the same way. They are supporting their loved ones. Similarly, there's increases, Ade has said, around child and family social work and support. And we've seen reports of an increase in use in temporary housing, which has doubled. There are latest figures showing the numbers of children who are unsettled in temporary housing. I think the latest report was around 125,000 children, and that's a real increase over the past 10 years. And due to the cost of living crisis, we've seen the biggest year-on-year increase in homelessness and people rough sleeping and that's the first time since 2015. So decisions that we make as managers and leaders on how we raise up the workforce to meet the needs of people will understandably have an effect, because this will no doubt have an impact on practice and how we actually deliver, how social workers, how social care workers deliver the roles that they're doing around. And it will have an impact on work satisfaction, people feeling motivated to keep working in the role. So as there's a record demand and increase, that's against a backdrop of record numbers of social workers leaving. But what the pandemic also did, I think, was help us to shift our thinking on our current transactional model and the way we talk about social work, and how personalised support can be provided to people in our local communities, rather than us being administrators of how services are delivered to customers. In some areas, managerialism and bureaucracy and the emphasis on process and procedures were temporarily reduced during the pandemic, and we saw social workers leading the way and working in different ways. We saw communities coming together and the rise of mutual support, and our ways of working shifted accordingly. And there's lots of positives around flexibility and responsiveness when working online, but we recognise there's also challenges with remote working. And we know that social work is about building trusted relationships, and sitting face to face is a really powerful way to enable this. Coming together safely, being in the same room is important, not only in our office workplace settings, but also with people we support. So we're listening and hearing around what workers are saying, how they want to maintain a hybrid, flexible way of working. And in our Skills for Care findings, our data for adult social care showed that the majority of social workers who are employed by local authorities, it's just under 17,500. So there was actually an increase of just over 1,000 social workers since 2011. So we've seen an increase up by about 6%. But in reality, there's a decrease in the total number of jobs within local authorities, a decrease as much as 28% over the same period. And as of September last year, there were around 2,000 vacant social worker roles in local authorities. So that's just over 11.5%. We've seen a high increase, as Ade said, a high number of reports around burnout, stress, trauma, moral injury following the pandemic. And as a result, there's an average of around 12 days of sickness, which equates to around 187,000 lost working days. So people experiencing high caseloads, feeling stressed, tired and burnt out, that affects turnover. And the turnover rate was around in the equivalent of around 2,600 leavers in the previous 12 months. So we know that our data shows that, yes, people are moving to work in agency, but and we have seen actually an increase in the nominal increase in full-time equivalent salaries. So the salary of social workers has increased by about 19%, from 32,500 to 39,000. Now, this is not a big positive headline that it could be promoted in that way, because actually, in real terms, the salary is around 5.5% less than in 2012 at the moment. And we know that the move to agency is not just about pay. We hear from social workers all the time who are really proud and committed to doing the work that they're doing. However, the reality is pay, terms and conditions, feeling valued and supported and invested in, having a variety in the type of work that people are doing, having the opportunity to stop for a moment and actually breathe and to not feel stressed and be on the never-ending treadmill, having good reflective supervision and the opportunity to explore good practice. These are the things, reflection in your work. These are the things that are important and will keep people in their roles. And this is the data and the information that we are sharing and spreading with our colleagues. And with the next generation of social workers entering the profession, we've seen an increase in newly qualified social workers being registered on the ASYE. And this year it's up 13.5%. And we think it's likely to be done because of the different ways, the different routes to qualify. So we're having the first cohorts of people qualifying from the social work degree apprenticeships. So we're seeing really positive movement and opportunities. However, on newly qualified forums that we have, we're hearing people about planning their exit, which is really concerning for us. So we're doing work around supporting newly qualified social workers to be able to grow and thrive and remain within their roles. And I think I've completed my 7.5 minutes, so I'll hand over to colleagues.
Thank you, Tricia. Fascinating stuff, and really taken there by the data and insight and responsiveness to that, which is really interesting. So we've got roughly about 15 minutes now left, which is a good amount of time for us to have a bit of a discussion and dig into some of the questions. So do continue to pass those in. We have had one in specifically for Sarah, just asking if you can tell us a little bit more about the 3 work streams that Social Work England will be promoting soon.
Yes, happily. Thank you to the colleague who asked that question. So as part of the roundtable, we recognised that as a group of system leaders, while we needed to come together to coordinate the activity and action on moving this important work forward, we were too big a group to really drill down into the activities that were needed. And it would make more sense to set up a series of work streams in order to take that action forward. And also in doing so, we would be able to include practitioners at the front line of social work practice, which is what we felt was really important as a group, so that we could hear directly from the front line of practice what was going on, what needed to happen as a result of that. And there was that two-way ongoing communication. So we agreed at the group that the 3 initial key areas to focus were recruitment into the profession and attracting new social workers. So that's everything from how social workers come into their qualifying courses, the selection process for that, working with education and training providers, right the way through to that initial post-qualifying phase that Tricia's talked about so eloquently around ASYE and the importance of setting up new practitioners well, with good supervision to enable them to want to stay in the profession and to want to develop, and that they will see a clear pathway for their professional journey and their career in social work. So that's the first. Then there is a work stream around agency and other working practices, including international recruitment and all of the things that I touched on earlier. It's felt that it was really important that we had something specifically to look at that, and again, hopefully involving practitioners within that, as well as agencies themselves, as I touched on in my intro. And then the third for now would be the retention of experienced staff and a work stream around that. And one of the really interesting points of discussion around this was about how in the past social workers developed a really robust portfolio of experience and expertise across the whole of the profession, rather than what we have at the moment, which is a very linear approach to your career. So you might come into children and family statutory social work or to adult statutory social work, for example, and you will stay on that path. And that's absolutely fine. But previously, there was a much more fluid approach to moving across the profession, building up skills and expertise in different areas, and then being able to use that skill and expertise to adapt your practice to other different areas. So building up a broad portfolio of robust social work practice. And we wanted to look at why we'd moved away from that as a profession and how we might facilitate looking at that approach again, in the hope that that also might encourage social workers to stay in the profession and to see lots more opportunities than maybe they might at the moment if they feel it's purely a linear pathway. So we'll be putting out a call out for expressions of interest to come and work with us on this. It will be a really tight turnaround, because obviously we want to get the groups up and running quickly and to be able to feed back into the roundtable so that we can make some decisions and ensure that action is moving forward as quickly as is reasonable. So hopefully that answers your question.
Great, thank you, Sarah. And Tricia, I think we've had another question in. This relates actually to something you've mentioned, which is about reflective practice. The question is, what do you see as the risk to practice and people meeting their professional standards as the workforce issues continue? And happy, Sarah and Ade as well, to bring you in on this. But Tricia, if we can start with you.
So the risk to professional practice. So we are supporting, and not just us obviously, but everybody is supporting managers and leaders, supervisors, to really be able to regain their the time and the opportunity to provide good reflective supervision. One of the things that we know, people, social workers, people working in social care, really value CPD, ongoing learning and development, being able to have those forums, communities of practice, forums where they can talk about their cases. We are working with much more complex situations than we have before. There's the knock-on effect of working in an online or remote ways, that people can often feel quite isolated. They're wanting opportunities to be able to talk about their cases, talk about their work. So we're supporting leaders and managers to factor that in, to be able to make time, protected time, to have ongoing supervision. And there is investment around learning and development and training, and having access to keep current and to keep on top of and keep abreast of the current themes that are out there. But also, as Sarah said, setting standards and expectations about people working at a variety of levels and what's expected of them at that role, and having a learning environment. So not taking a punitive approach, but constantly learning and hearing and developing and growing. And we think time and just the enormity of the caseloads and having time is the risk of to developing and delivering good practice.
Great, thank you, Sarah. Ade, shall I bring Ade in? Ade looks like he's going to speak.
No, just really adding to what's been said. Two key points. The only way you're going to retain enough social workforce in your own organizations is actually through having clarity in terms of your practice issues, and as Tricia rightly said, in terms of supervision, reflective practice, and the space for social work to flourish. Without that, you're going to recruit, your workers will come in, they'll go. And one of the key things that I mentioned earlier on, in terms of the development in London through the practice standards, is exactly that, whereby local authorities can actually sign up to that. That is the only way of actually keeping your staff.
Thank you. And Sarah, anything to add?
Thanks. Yeah, just a couple of points really, which will echo and hopefully support what Tricia and Ade have said. I think what we've learned from some of the research that we've done so far into social workers' early experiences in their career, and also through the anecdotal intelligence that we pick up through our ongoing contact and dialogue with the social work profession, is that one of the absolute fundamental things early in your social work career is your relationship with your supervisor or team leader. That is absolutely crucial. It was one of the key things that social workers identified as what was likely to keep them in the job. And this is where I think at times as a profession, we can shoot ourselves in the foot, because what we're really good at in social work is growing our own. So we're really good at trying to encourage people to stay and then promoting them into management roles. But when we do that very early in their career, and we do that in a way that throws people in at the deep end, often without the necessary training and experience wrapped around them. This was very much my experience early in my career. I all of a sudden overnight was made team leader, probably far earlier than I should have been. I'd never dealt with a budget before, I'd never dealt with HR issues before, and I had no training whatsoever to help me to deal with that. So what you then create is another perfect storm of team leaders who are burnt out, stressed, and not in a position to provide that reflective space because they're too busy trying to deal with trying to make up the gaps that they have to meet their current roles properly. So there is a real need to look at that and to support our emerging managers and ensure that they are equipped with the tools that they need to provide adequate support to their staff. And the other thing is an ongoing myth really about CPD. CPD is a fundamental part of social work practice. We require social workers to evidence their ongoing CPD in order so that they can reassure the public that they remain fit to practice and that their skills and experience are up to date. However, CPD can be a whole variety of different things. It is not going on a 1-day or a 2-day training course. CPD is going back to the office or even having a Teams call after a difficult visit or a really positive intervention with a service user and talking to your colleague about it. It is about impact on practice. It might be a book you read. It might be an article that you read that you can link into something that you're doing in your practice. So CPD is vast, and I would really encourage colleagues to think about it in that broader sense rather than just that kind of very narrow training course or qualification type approach, which we often get asked about.
Thank you, Sarah. That's really helpful. Another question that we've had in, this one chimes with me being in comms and engagement. John Lewis undertook a fostering recruitment campaign with their Christmas TV ad. What is the profession doing to raise this, the profile of social care nationally? Where is the innovation and energy to do this on behalf of the profession? And it gives the example of national adverts to recruit teachers, for example. Where should we start? Ade, should we go to you first?
Yeah, I'm quite happy to look at these. So in the context of what I said about London, so if you were to think about the 3 key things that we're doing to tackle the key messages from social workers in terms of perception. So one is actually the new microsite, whereby for the first time, London local authorities are coming together really to champion the recruitment of our frontline staff. And I think by next month, April, when that's out, that's going to be an opportunity for all of us to really recognize the game. Apologies for colleagues who are not in London. That is actually quite innovative in that way. The second, through the support going through directors of children's services, is also the national campaign. A good example is what we're doing this week. So I'm expecting in different local authorities, the directors and chief executives have got events planned all week, really to celebrate the fantastic work that our social workers actually do. And I think we need to continue to do this, not just for this week, but every single time, in terms of the ability and the opportunity really to champion what we do locally in our local press. Again, I can only speak for my own local authority where we do get good examples of in terms of intervention. Let's really go out and celebrate. Bearing in mind, it's the same colleagues in the media that will condemn us when we don't get things right. So let's actually celebrate the fantastic work that we do in as social workers. The third, just really coming back to the point in terms of the adverts, we do this really well for foster carers. We do these really well for some of what I've seen around children with lived experiences. Again, championing what they do in different local authorities. And I think the more we do these, the better in terms of changing the image of social workers as coming in to take your children away and only getting the limelight when things go wrong. My take on this every time, as I said, is we are a fantastic group of people, and we really need to keep doing what we're doing in the same way that we know we're changing some of the key challenges in our society. So I think, yes, wouldn't it be great, Sarah, a fantastic opportunity for joint Social Work England local authority publicity in terms of what we do in social work. I will continue to champion these as long as I carry on in my role in London.
Thank you. Sarah, anything you'd like to add? Then we'll come to you, Tricia.
Well, I'm very pleased that somebody mentioned the John Lewis advert, because with my other hat as vice chair of Who Cares Scotland charity, we were part of designing that advert and worked with John Lewis on the importance of positive messages around the care experience community. So thank you, whoever the colleague was who mentioned that advert. It's something very close to my heart. And to your point, Ade, I would say watch this space. It may well be something that is coming in the near future, and we would be really keen to be front and center of that.
And finally, Tricia, any thoughts?
Yeah, and I'm wondering how many people are aware of the national recruitment campaign for social care called Made with Care. That started in November, and actually it's the second year that it's been running. And we've been working with the Department of Health around the national recruitment campaign. So again, it's around really celebrating the role of social care, talking positively about the career aspirations, the various careers, but also we're working with schools and colleges nationally to raise the profile with young people and attract young people into social care. And in this forthcoming year, I forget which financial year we're in. So this forthcoming year, we've got a real focus on not only attracting young people, but also attracting men into social care as well. So we're doing a lot. We're hoping to see an impact, but most importantly, as Ade said, we're changing the narrative around how we talk about social work and social care, and really being proud and positive about the work that we have done and the individual contributions, but the contributions of the sector as a whole.